An opinion piece published in the Lancet has sparked intense scientific debate about who needs COVID-19 vaccine booster doses and when. For the general population, the debate seems to boil down to whether or not boosters should be given at all. While joining us for more on the story tonight, we're joined by the National Immunisation Safety Expert Committee Chairperson, Professor Hannelie Meyer. Professor Meyer, good evening, and thanks for your time. So we've seen this conversation take place globally in the US, even before, vaccines had reached parts of the African continent. People were already queuing to get their third booster shot. So in terms of this debate now, where are we?
Yeah, indeed. As you say, these countries, they started rolling out the vaccines, quite well ahead of South Africa. So they have started now to recommend booster doses. But as you say, there's now, a lot of debate going on at the moment. So the question is, why would we need booster doses? Firstly, we have seen waning of immunity, especially in those countries, where they've got a lot more data compared to South Africa. And then it's also to do with the effectiveness of the vaccines. So with the different variants, and we have seen now breakthrough infections, but these breakthrough infections are mostly, mild. So the evidence shows that these vaccines still protect very well against severe disease, hospitalization, and death. And then there's also this group of people with weakened immune systems, those with, for example, with HIV, or people who've had organ transplant. So these are the things that we need to consider when we think about whether we're going to give booster doses or not, and when.
When we talk about waning immunity, from the research that's available out there, how soon does this begin to happen?
It all depends. So there's lots of studying going on, and the reason for that is that the immune system is very complex. So there's a lot of studying that various researchers are still doing with regards to the immune system. So when you get the vaccine, you build up immunity, so you have all these immune cells, and then they start waning with time, and you are left behind with this pool of memory B cells and T cells. No, what they are seeing at the moment, it seems as though these cell-mediated immunity will actually last longer than what we thought. But with regards to the Pfizer vaccine, they've seen, immunity waning after approximately 4 months. So it all depends on which vaccine you got. And then, as I say now, they are thinking, they think that the cell-mediated immunity will actually last much longer than we expect, but which will then mean that we wouldn't need booster doses immediately. But, as I say, a lot of research is still going on, things that they need to determine when it comes to how long your immunity will last.
So what does this mean, Dr. Meyer? Does it mean that the debate we were having about vaccines, which quality, the quality of vaccines, the efficacy against COVID-19, that conversation becomes even more important when we're now debating the need for booster shots or not, because we know that they don't all have the same efficacy?
Yes, so South Africa, the Ministerial Advisory Committee on Vaccines, they are looking at, what is the possibility of, or the need for boosters, when do we need to consider it, they are discussing all these factors. But as you say, with the vaccines that we have at the moment, they still provide very good protection against severe disease, hospitalization, and death, which is the ultimate goal that we are looking at. And this is also in line with the World Health Organization's, initial goal. So when we look at South Africa, when we have only fully vaccinated approximately 18% of our adult population. So there's still a lot of people that we need to vaccinate. In other words, people who haven't even received the first dose. So the goal at the moment is to vaccinate 70% of the adult population by Christmas. So, if you think of how are you going to control this pandemic, get a hold of this virus and go back to normal, it means we need to, as fast as possible, vaccinate as many people as possible. So, then you ask the question, would it then really make sense to start giving boosters now while there are so many people out there who haven't even received the first dose? And, the more people we have vaccinated, the fewer the opportunities for the virus to spread, to change, to mutate, and then we're ending up with new variants.
Of course, many then will be pointing to the fact that if the efficacy of the vaccine, again, depends on the amount of time, for those people who would have been vaccinated in July, they'll, of course, begin to question by December, going into, 2022, if they're still protected from COVID-19.
Okay, so now when you look at the waning immunity, so what they have found, although your immunity would be waning, you still have that very good protection against severe disease. So, and as I said, looking at the cell-mediated immunity, they think now that the immunity will actually last longer in protecting you against severe disease. So, and that is the aim, is to keep people out of the hospitals and to prevent people from dying. And the more people you have vaccinated, the fewer the chances to actually spread the disease. And what they've also found now is that if you are vaccinated, your chances of developing or ending up with long COVID is 50% less. So long COVID is also something that we need to think of, because, the longer we wait in vaccinating everybody, the better the chance that those people will actually then get COVID and also end up with these long COVID symptoms. And, they don't know really at this point in time how long it will continue and how to manage it. So, so should there be a need for booster doses? In my opinion, they will prioritize people. So, for example, as I said, people with weakened immune systems, it might be necessary for them to get a booster dose. Those who are on certain treatments, or maybe those with cancer, those would then be all the elderly people, or maybe people that are, at very high risk of severe disease, or, working, like, for instance, healthcare professionals working in ICU units and so forth. So they might, I think, be the people that they will consider to first, provide with booster doses.
Professor
but the aim is to yes.
Just before I let you go, Professor Meyer, we're also seeing reports of people, and again, this has taken place more in Europe, where people are going for double doses of vaccines. So basically getting the Pfizer and the Johnson & Johnson. Talk to me a little bit about that.
Yes, so that's another factor, that we need to think of in terms of booster doses. So at the moment, the World Health Organization is not recommending, using one vaccine and then get another vaccine as a booster dose. The reason for that is we don't have sufficient data of the efficacy, and the long-term effects, as well as the safety. So talking about safety, you wouldn't necessarily want to give booster doses because, people, we don't know yet what will be the safety profiles, and you don't want people to end up maybe with more severe or unnecessary, adverse effects, side effects. So, yes, so at the moment, it's not recommended that they will be, sort of mixing the doses. But yeah, time will tell. But as I said, the World Health Organization is is not recommending it, but there are definitely countries doing that, yes.
National Immunization Safety Expert Committee Chairperson, Professor Hannelie Meyer, thank you for your time tonight on News at Prime.